introduce you to our first guest for this evening. So we've got Callum Haseler, who's joining us tonight, and he works in a first opinion large animal and equine practice in Norfolk, but he's also heavily involved in sustainability through his role as the chair of the British Equine Veterinary Association, or BVMS, Sustainability Working Group. Since their formation in 2021, the group have provided resources and support for vets and owners to be more environmentally sustainable, and have been involved in the publication of various papers, including on equine anaesthesia and parasite control as well. Callum's going to be speaking to us tonight about wormers in the environment and the unintended consequences of everyday treatments. I have to say, I'm really looking forward to his presentation. We actually met Callum at the Beaver Congress back in September. He presented a really, really interesting talk there on sort of the environmental consequences of different medications and parasite treatments. And it was so interesting. So I think this area is just something which isn't talked about enough. So we're thrilled to have Callum with us this evening. So thank you very much, and over to you, Callum.
Brilliant. Thank you very much for that kind introduction, Katie. I will just see if I can share my screen. So hopefully that's come up. Is that all right?
Yeah, that's perfect. Thanks, Callum.
Perfect. Okay. I'm Callum Haseler. As Katie sort of said, I am going to speak on something we probably don't think that much about on a day-to-day basis, which is the environmental and sustainability impacts of equine wormers. There we go. So, yes, Casey's given me a very kind introduction. So I actually work in mixed large animal practice. I'm predominantly equine, but I do a bit of farm work in Norfolk. So I am just a first opinion vet for most of my life. So I feel very privileged to speak alongside the highly esteemed Jacqui Matthews. And thank you to Dengie for inviting me. As Katie said, I am also chair of BEVA, the British Equine Veterinary Association's Sustainability Working Group. We have been working for sort of 4 or 5 years now, and working on a number of resources, essentially trying to make life more sustainable for equine vets in practice. So, the environmental impact of equine wormers. Well, I appreciate this probably isn't the sexiest of subjects, but I'll hopefully add a bit of bulk to it and make it interesting for everyone. As we all become more aware of our carbon footprint, of our environmental impact in life in general, and the general public, I think as equestrians we have an obligation to be active in this field. So in this lecture, I'm going to run through what the problems are from an environmental perspective with equine wormers, why it matters, summarize the current evidence and lack of evidence where we don't have enough data, and provide some evidence-based guidelines on using these drugs more sustainably. So what is the problem? Well, over the last 50 years, a growing number of studies have documented a huge decline in insect populations and diversity worldwide. And a report by UK Parliament concluded that residues of veterinary medicines are likely contributing to this decline. So wormers are drugs that we all use routinely throughout the year, but we probably don't think about their unintended consequences or what happens to them after we give them to the horse. So they're designed to target specific parasitic worms, but the processes they target are often shared among many different species. So if we don't use them carefully, they can have serious detrimental impacts on natural invertebrates, natural insects. Recently, a growing number of studies have demonstrated a couple of these are small animal ectoparasite treatments, so fipronil and imidacloprid, which is a neonicotinoid, and these have been picked up in British waterways in the UK. Both of these drugs have been banned for agricultural use since 2018, so we know that any emissions going into the watercourses must be coming from veterinary use. As I say, these are small animal flea products, but it's only a matter of time until the equine world comes under the microscope. So why does this matter? Well, firstly, insects play a really key key role in a number of different features. So for anyone interested, this book, Silent Earth, by Dave Goulson, it's a really eye-opening read, and I can thoroughly recommend it. He runs through all the sort of reasons we should care about insects. Firstly, insects are intimately involved in almost every food chain. And we know that loss of insects has been directly correlated with loss of insectivorous birds such as swallows worldwide. Insects are crucial for pollination, so 87% of all plant species and 3/4 of our food crops require insect pollination. And we're beginning to see the impact of inadequate pollinator numbers on food production across the world. And lastly, insects provide a number of really important ecosystem services. So this is a technical term which is given to a broad range of beneficial effects. The best example is dung beetles. So in the UK, there are 60 species of dung beetles, and one study has estimated their value to the UK cattle industry alone to be £367 million. And I will come on to this a bit later in sort of explaining, but here's the study just for interest. So secondly, we know that the public care about this. So pollution of rivers and waterways has recently received a great deal of media attention. So much so that a specific cross-government group has been set up to address the levels of those two substances, fipronil and imidacloprid, in UK waterways. And so from a social licence perspective, again, as a questions, we need to be seen to be doing the right thing here. And lastly, as a profession, vets are hugely passionate about environmental sustainability. So in 2024, there was a British Veterinary Association BVA survey, which found that 93% of vets thought environmental sustainability was important to them. And in a BEVA survey, so British Equine Veterinary Association survey in 2021, vets were asked, do you think going green would benefit your practice? And a resounding 73% said yes. So as equine vets, whilst the biggest part of our carbon footprint is transport, parasiticide treatment is an area that's coming under increased scrutiny, and it's one in which we can make a big difference. So what do we know? Well, a BETA, so British Equine Trade Association, sorry, lots of acronyms here, a BETA survey in 2019 estimated there were 847,000 horses in the UK, and that probably has changed slightly since then. But data from BEVA in 2018 estimated that there were 1.1 million equine wormers sold per year. And many of the current resources we have focused on responsible use of these drugs, of wormers, and on resistance to wormers. And we're probably a few steps behind our farm animal colleagues who've been working actively in the area of ecotoxicity and sustainability for a number of years. So this is an article we published in one of the equine journals, Equine Veterinary Education, EVE, in 2023. This article looks at both the impacts of ectoparasites, so things like lice and mites treatment, and also endoparasites, the wormers that I'll come on to shortly. So as Katie said, I spoke at BEVA Congress last year on ectoparasite treatments. I won't dwell on it here, but for anyone interested, I'll include the links at the end of the lecture. So if you want to look in more detail, or if you have any questions, let me know. So coming on to wormers, now Jacqui will go through this in more detail, I'm sure, but don't get hung up on this table, but it's mainly just to say there are 4 main classes of wormers we commonly use in horses. I'll go through these in turn. So the macrocyclic lactones, this is ivermectin, which people will probably be familiar with as Ecfelan, Noromectin, Erequel, and moxidectin. Sorry, I should say among others, this is an extensive list. Moxidectin, which is mainly Equest. And I should also say, so doramectin is an off-license treatment in that it is licensed for cattle and sheep, but it is sometimes used for the treatment of choreoptic mange, so feather mites in horses. Now, these are all extremely effective parasitic treatments, but unfortunately, the majority of your ivermectins, so up to 98%, are excreted unmetabolized in the feces. And we know from studies in cattle that these are extremely toxic to dung beetles, freshwater, and other terrestrial invertebrates, so other land-dwelling insects. In terms of toxicity, Ivermectin is slightly more toxic than moxidectin, but it's eliminated slightly faster. So moxidectin takes a bit longer to come out of the system than ivermectin. Now, doramectin, because it is an injectable formulation, it's given into the muscle, which means that it is excreted for a much longer period, which means that its ecotoxic potential is probably, we don't know 100%, is probably much greater than oral ivermectin. So from studies in cattle, we know that after injection into the muscle, doramectin can be excreted for 180 days or more. And then lastly, for ivermectins, I should just say that in addition to its ecotoxic effects, it is also toxic to certain collies and collie type dogs. So second class, fenbendazole, which people are probably familiar with as Panacur. So this is metabolized more extensively than the ivermectins prior to excretion. And evidence suggests that its toxicity overall is lower than your ivermectins. However, it is still toxic to certain aquatic invertebrates, so it's not benign. And then your last two, so Parantel, which people would be familiar with as Strongid P or Pyrotate P, and Praziquantel. Praziquantel is only commercially available in combination with other drugs. So these are your duos, your maxes, and your pramoxes. But there is a special formulation, which is Praziquantel only, that has been developed in an attempt to reduce the overuse of things like ivermectin and associated resistance. So both of these are probably less toxic than the other classes, but actually, in all honesty, we don't really know. There isn't a huge amount of evidence. So I touched on this idea of ecosystem services that invertebrates, especially things like dung beetles and other what we call coprophages, so poo-eating insects, provide. And this paper by Sarah Bainan, which I'll reference in a second, suggested again that dung beetles alone provide about £367 million of value to the UK cattle industry. So how do they do this? They improve soil nutrient cycling, they improve soil structure and drainage. They provide biomass and they reduce loss of nutrients from the soil, and they regulate pests, gastrointestinal parasites, and disease. So what happens if we kill these off with veterinary wormers? Well, we see reduced fecal degradation. Feces then build up on the pasture, and this leads to loss of available grazing area. And we also see increased spread of pests and pests such as flies. So I've put a picture up here of Australia. Why have I done this? Well, going back to the 19th century when European settlers first introduced cattle to Australia, the native dung beetles were actually unable to break down cowpats, and that's because they were much better equipped to break down really dry droppings like kangaroo poo, for example. And so, as a result, the cowpats built up on the pasture, and by the 1950s, the area across Australia covered by cowpats was estimated to be increasing by 2,000 square kilometres per year. So it was only when they actually introduced new species of dung beetle that the cowpats stopped accumulating and they were able to regain that grazing area. So the big caveat to this is when we come on to horses, we don't know how applicable all of this is. Sorry, so there's the reference from Sarah Bainan. Yes, how relevant is this to equine pastures? So for the majority of our clients who are poo picking regularly, we're removing those droppings from the pasture. So there's probably not that much to either build up or be broken down by dung beetles. However, in certain systems where either horses are living extensively or where poo picking isn't performed, then it probably does have that same relevance as it does with cattle. And lastly, so this is again something we probably don't think that much about when we're grabbing a wormer off the shelf or giving it to our horses, is the effect on the equine gastrointestinal microbiota. So these are the good bacteria that live in the gut. So we know that the interaction between parasitic worms and the bacteria in the gut is a very fine balance, and that the interaction between this is important in regulation of immunity, inflammation, and disease. Whilst we don't completely understand this at the moment, we know that disruption We know that this balance is disrupted by wormers, as you'd expect, because it's killing off the worms, and that disturbance of this balance can lead to a gut dysbiosis and may play a role in inflammatory conditions such as acute larval cytostominosis, which I'm sure Jacqui will come on to later, but is a potentially fatal condition, especially of young stock. So, what can we do to reduce all of these potentially ecotoxic effects, but still use these wormers when we need them? Well, the main thing to say, and again, I'm sure Jacqui will come on to this, but the days of blanket treatment should be firmly behind us. So not only from an ecotoxicity perspective, but because of growing resistance. So we need to only be treating above a set threshold, and this is typically now accepted as 500 eggs per gram with a few caveats. And again, as I'm sure Jacqui will come on to, we need to be applying this same targeted approach to both tapeworm treatment, which means testing for it. There is a blood test or using the EquiSal system, and the same risk-based treatment for encysted redworm. So currently in the UK, far more doses of wormer are sold than the number of worm egg counts performed. And if we were following a proper targeted approach and we were always worm egg counting horses and only treating them when low, you should expect more than two worm egg counts per dose of wormer sold. But actually, if you look at the data, it's totally the opposite way round. So sales data from that study in leading up to 2018 suggests that for every worm egg count performed, 11 wormers are sold. So it's about 20 times greater than it should do. So one optimistic way of looking at this is that there is a great potential for improvement. And then lastly to say is that when we are administering wormers, remember those relative ecotoxicities. So if possible, use the least ecotoxic drug. But again, the big caveat here is that this needs to be balanced with the efficacy, so the effectiveness of the wormer you choose against your target population, and also the resistance to those drug classes. So, secondly, is to say that pasture hygiene, so poo picking, is critical and should be the mainstay of parasite management in the worldwide. So poo picking reduces the parasite burden on the pasture, and if it's combined with appropriate diagnostics, this will then lead to substantial reductions in anthelmintic use, which in turn then reduces both the environmental toxicity of these drugs and also the selective pressure for resistance. So strong guile eggs develop into infective third stage larvae within 3 to 4 days at the optimum temperature. Now that optimum temperature is about 25 to 33 degrees. So from that, our recommendation is that we should poo pick at least once weekly for the whole of the year and at least twice weekly over the summer grazing season when we expect those higher temperatures. Now, from a sustainability point of view, there is some debate about leaving some of the fresher piles of feces to then feed some of these natural invertebrates like dung beetles. Dung beetles prefer droppings that are less than 48 hours old. So in theory, you can, if you've got uncontaminated feces, so they haven't got wormer in them, you can leave them on the pasture for up to 48 hours, allowing the dung beetles to eat them, but then removing your older ones, so you're still breaking that cycle of infectivity and development of those infective larvae. But how practical this is in real life, I'm yet to be convinced. And then the last thing to say is that stocking density also has a major impact on the level of pasture contamination. So it's recommended 1 to 1.5 acres per horse. But we also need to consider here various management factors. So whether or not dung is removed, how frequently, the age, size, and number of horses that graze the pasture, the amount of time that they spend grazing the pasture, the season, so time of year, and how well the pasture is managed in general. So we talked a little about what happens to these drugs after administration to the horse. And I said for ivermectin and moxidectin, they're largely excreted, excreted largely unmetabolized in the feces. So for ivermectin, we know that 90% of the drug is excreted by about 4 days after treatment. Whereas for moxidectin, it takes slightly longer, so 90% eliminated by 8 days after treatment. Fenbendazole, as I say, is metabolized a little more extensively within the horse, and for parental and praziquantel, the answer is we don't really know. There isn't the data to support it. But from all of this, our recommendation overall is that after a horse receives a wormer, they should either be kept stabled and droppings put in a muck heap, or we should be removing the droppings daily from the pasture so they're not allowed to contaminate the pasture for 7 to 8 days after worming. And for longer, if you're using moxidectin, so Equestra or Equespramox, we recommend 12 to 14 days. Droppings should then be put in a muck heap, and we know that given time, these toxic drugs will degrade in a muck heap. But how long does this take? Well, studies have shown that ivermectin can persist at toxic levels for at least 6 months, and it is slightly dependent on conditions, sunlight, temperature, and so on. But again, our recommendations is that we should store any feces contaminated with wormer for at least 6 months. Muck heaps should also be situated as far from watercourses, ponds, and drains to reduce the risk of runoff. And this is, so they say 10 metres on flat ground and 30 metres to the land sloped. This is actually from government legislation. The other thing to say is that risk of rainwater runoff will be reduced if we can put a roof or a tarpaulin over the top of the muck heap. So the table on the right here, that's pulled directly from that paper I mentioned earlier, and that just outlines the recommendations I've just run through. I just wanted to finish on a couple of resources. So for anyone interested, the Beaver Sustainability Working Group have published guidelines on sustainable parasite treatment, and these include both guidelines for vets and help sheets for horse owners. So those are all available on the Beaver website, and I've put the link just there. Secondly, the Beaver Primary Clinical Care Guidelines. So these are more aimed at vets, but for those who are more technically minded or want a deeper dive into the underlying evidence, this is a really good article, and it lays out all the evidence for the current recommendations. The Beaver ProTechnique 2 toolkit has come out recently. Again, more aimed at vets, but a very useful toolkit overall. And it does have a small section on environmental sustainability. And then lastly, for anyone who hasn't seen the Cantab guidelines. So Cantab was initially set up as a project under the Veterinary Medicines Directorate, VMD. It's now funded by industry, and it operates, I have to get this right, under the Companion Animal and Equine arm of RUMA, which is the Responsible Use of Medicines Alliance. So again, probably more aimed at vets and SQPs, but worth a look. And there's a whole chapter 7 on environmental considerations. And I've just included as the last thing a screenshot of that worming help sheet from the Beaver Sustainability resources, 8 steps for sustainable worm control. So hopefully that just summarises everything that I've just run through. So I hope that's been helpful, interesting, and if anyone would like to access the slides or resources, please let me know, and I'd obviously be delighted to discuss anything with anyone interested. Thank you.
Oh, that was absolutely brilliant, Callum. Thank you very much. I think we will take a lot of useful information from that. If anybody has any questions for Callum, do pop them in the Q&A box. But I'll kick us off. We've just got time for a few before we move on to Jacqui's presentation. So firstly, Callum, this is a question from me actually, is as a vet, you're of course regularly seeing horse owners at their yards and things, and we've got a lot of people joining us tonight who are BHS and Pony Club coaches, and they're often the first port of call really for advice from a lot of their clients. Do you have any guidance for them when it comes to pointing horse owners in the right direction in terms of what they should be doing with worming protocols, and any sort of suggestions, I suppose, in terms of communication to get the key messages across to them?
Yeah, it's a really good question, because I think it's often seen as it's a boring subject, isn't it? And often the big livery yards, there's just a yard policy, and it will be run by one person, and there's not necessarily a lot of buy-in from people. And so I think always the first thing is trying to get people to see that actually this is an issue, and realize these sort of unintended consequences that maybe these these are having. And so I think we've been having this conversation, hopefully, for a number of years now on resistance, and breaking this idea of just giving a blanket wormer throughout the summer season from a resistance point of view. But I think people just don't realise that actually these are toxic drugs, and they probably have unintended consequences beyond that. So it's I think it's just opening that dialogue with yard owners, with horse owners in general, but anyone who's making those decisions probably on a larger scale. That it's hopefully there isn't a right answer. I'm not perfect in my practice, and I know that we have to be pragmatic in what we're advising. But if you don't realise it's a problem at all, then you're never going to do anything about it.
No, brilliant. Yeah, absolutely. I think it's something, isn't it? It's kind of hard to always engage people in, but it's just trying to make it interesting, which I think you've done a great job of doing this evening for people. We've had another question come in from Melanie. She said, as an SQP, we see a lot of vets recommending Pramox all year round. Any thoughts on why that is?
Yeah, and this is a battle that we come up against all the time, and I think there is a lack of education at times, because we will still have people performing the EquiSal test at seemingly random times of the year when it probably isn't clinically relevant, and so I think it's trying to have a coordinated approach, that there's clear guidance, and hopefully all of those resources that I've laid out go some way to that. But then that trickle down to say,
oh, we've lost sound for you, Callum. I'm not sure if it's just for me.
we all need it. Is it?
You're back.
Can you hear me now?
Yeah, that might have just been me. Sorry, I'm not sure, but no, we're great.
Oh, fine. Yes. So I can't remember what I was saying there.
Sorry, you're saying about sort of the information trickling down.
Yeah. So clear guidance, but also asking those questions. Why are we using Pramox at this time of the year? Why are we performing this test? Is it an appropriate time? So consistency, I think, is probably key.
Yeah, absolutely. Thank you. And then one question which we actually had come in prior to the webinar, and we did have a quick chat about this before we started the webinar tonight. Somebody's asked about using diatomaceous earth as a supplement, and I know you said you had a bit of experience with this in chickens. Would you like to share your thoughts on that?
Yes. So we had a bit of an interesting thought on this, and the short answer is I have no experience of using it as a wormer. So my experience and sort of understanding of diatomaceous earth is actually in chickens. So we have 2 rescue chickens, which we've had for about a month and a half now. Now, for external parasites in chickens, so mites and lice, diatomaceous earth can be quite useful to go into their coat as a dust bath. It's essentially dust which has very sharp edges. And those sharp edges are thought to break down the chitin, the hard shells of these parasites. I don't know how effective that would be within a horse's gastrointestinal tract, whether you get it anywhere near the concentration that would be required to do this, because if you think you're applying it to the outside of an animal, you're using it straight. And the other thing which slightly concerns me, although without any evidence, is that I would worry about damage to the horse's gut lining if we're using something which is effectively an abrasive, because we know that sand within the guts does one of 2 things. It either causes an impaction, sand impaction as concrete, or it causes an enteropathy where it irritates the lining of the stomach, and that's because it's acting as sandpaper. So I would worry slightly about using an abrasive substance within the horse's tract. But yeah, I'd love to see some evidence if there is any on that.
Brilliant, thank you. So I think we're going to just take a pause on some questions for now, just so we can crack on. There are some that have come in on the Q&A, so feel free, Callum, if you're happy to have a little look at those, or and then we'll move on to Jacqui's presentation. So Jacqui, I think if any of you have seen any of our webinars before, I think, Jacqui, this is your 4th Dengie webinar now, so Absolutely thrilled to have you back. They're always brilliant. And yeah, thank you for agreeing to come back with us this evening. So I'll just tell you a little bit about Jacqui for those of you who've not seen her present before. So Jacqui firstly qualified as a veterinary surgeon before completing her PhD at the University of Glasgow. And during the next 25 years in academia, she's conducted numerous research projects looking at sheep, cattle, and horse worms, whilst also teaching at 3 of the UK's vet schools. Jacqui's research has now generated more than 160 published papers, which is incredible. And she has authored numerous articles, given seminars, and for many years, she was the parasitology expert on the UK Veterinary Products Committee. She's also a member of several subgroups of the Cantab initiative that Callum mentioned, and this was set up to develop and promote best practice guidelines for worm control in horses. One of Jacqui's inventions was a diagnostic blood test for equine small red worm, and this was commercialised by Austin Davis Biologics in 2019. In 2022, she moved to this company as the Director of Veterinary Science, where she leads the research and development programme, supporting the use of innovative diagnostics for evidence-based worm control to improve equine health. So she's got lots of knowledge, which we're delighted she's going to share with us tonight. So I will hand over to you, Jacqui.
Thanks very much, Katie. Made me feel a bit, yeah. Just hopefully, is that sharing okay? Yeah.
Yes, that's perfect. Thank you.
Yeah. So I'm not going to talk too long tonight. You'll be glad to know I've given myself, I think it's half an hour slot. So what I'm going to do is I'm going to cover things that we need to consider for equine worm control in spring. And so it's really an important time of the year to start planning ahead, because we're entering the season of main transmission of parasitic worms on paddocks. And as Callum actually mentioned earlier, that transmission across the paddocks speeds up in the sort of spring and summer as it gets warmer, because the stages that go out in dung aren't infective to horses immediately. They take a little time to develop through to their infective stage, whether they're a small red worm or whether they're a tapeworm. And we have to think about the impact of climate and the environment on the development of these stages. And springs are a really important time to think about that, because this is when everything starts to speed up. I was actually delighted to see there was a worm moon a few weeks ago. I didn't know anything about that. And people say, oh, it's because it's the earthworms actually sort of came out from the earth at that time of year, and that's why it's called the worm moon in March. But actually I was thinking more about parasitic worms, and that's the time that they start to come and become more active. So in terms of planning for the year ahead, we've got to think about our grazing management, and that will depend on the type of stock we've got, the fields that we've got and their history, and also practical considerations, what's pragmatic, what things can be done and what's achievable. We have to think about the sort of tests that we can implement to identify the parasites that are present there within the horses that we're keeping. And we've got to think about the type of stock and the type of parasites that they're susceptible to. And then part of that plan, of course, is the use of wormers. And we've got to think about, well, are we going to use wormers? How are we going to worm them? How are we going to use them? And that will depend, obviously, on the type of stock and the management, which I've just mentioned. Very briefly, it's really important now, because resistance in wormers to wormers is so common, particularly in small red worms, and emerging in tapeworm and very prevalent in ascarids. We really have to think about considering whether or not our wormers work or not, and that involves testing the effectiveness of those wormers. Now, at the bottom of all this, these thoughts, and as we plan ahead, is a risk assessment, and that's where we're going to start in terms of our worm control plan in the spring. Now, before we go into our risk assessment, I just wanted to give a quick jump back to the life cycles of these worms, just to give you an idea of the cycle in terms of how we consider transmission and how we assess risk. Now, as you know, this is a small red worm life cycle. And horses become infected by eating these third stage larvae with grass. You can see them here. These are tiny, about 100 micrometers long, and you can see them under a microscope, but not with the naked eye. So the horse ingests these larvae, and they go into the gut lining, the gut wall, and they can undergo a period of development in there as encysted larvae. And that can range from a couple of weeks up to very many months. And then later on, these larvae continue their development, and the L4 stages emerge from the gut wall into the tube or lumen of the intestine, become pre-adults or L5, and they mature to become male and female worms. And then the female worms release eggs, which are excreted in the dung. And these are strongyl eggs, which I'm sure many of you will recognise here. And these eggs hatch within the dung to release L1 and L2, which molt to L2, and the L2 molt to L3. And this period from the eggs to the infective L3 can be as short as 1 to 2 weeks in the ideal conditions in the United Kingdom, above 20 degrees. And with a plane of moisture, these infective L3 migrate quickly out of the dung onto the grass to be consumed by horses that are grazing that particular paddock. Now, I've just put in the tapeworm life cycle as well, because it's got a little fly in the ointment, or shall we say the mite in the ointment, because it's a bit more of a complex life cycle. And what we find is that there aren't male and female worms. There are hermaphrodite adult tapeworms, and these look like big sort of conchiglia pastas. And what happens is with the hermaphrodite adult tapeworm, they produce these fertilized segments as they grow at their tail end, and then they release these segments when they become full of eggs. Sometimes they release empty segments, but other times they release segments full of eggs. And these segments break up as they move down the intestine, and it's the tapeworm egg that's then excreted in the dung. But that can't develop without being eaten by an uninhibited mite. And that mite, serendipitous, we think, eats the tapeworm egg when it enters the dung. It goes in to break it down, and it eats the eggs as part of its processes within the dung. And within that mite, the tapeworm larva then hatches out the egg and develops through to an infective stage known as a cysticercoid, and that can take 2 to 3 months. And then horses then become ingested by eating the mite that contain these tapeworm larvae when they eat grass, and then they're swallowed, the mite's digested, and out comes the tapeworm. So it's really important to consider these life cycles when we're talking about reducing transmission and controlling worms. And it's important to remember that uninhibited mites actually are hugely abundant in soils, with about could be thousands and thousands of mites on an individual equine paddock. So they're there ready to eat the eggs. Now, as I mentioned before, the first step in planning our worm control program in the spring is really to undertake a risk assessment. And you're looking at that horse, and you're looking at the paddock it sits on, to try and understand the level of worm infection that that horse or that group of horses is likely to have. And the questions that we ask within the risk assessment are really trying to place what that level of burden is on those paddocks and in the horses that graze them. So we need to consider whether or not herds are open or closed. Are they at risk of new worms coming in and resistant worms coming in? How many horses are within that grazing group? What's the group structure like? Are there youngsters there? Because what we know is young horses are much more susceptible to worms than adult horses between 5 and 20 years. And then older horses above 20 can become more susceptible to worms again. We've got to think about how closely these horses are packed onto paddocks, or is it more extensive, as Callum mentioned a minute ago. And then we've got to think about if it's an open herd, for example, is there a quarantine policy? Do we need to be concerned about incursions of different parasites or resistant parasites? Something to consider as well is there any history in the background that might suggest that these horses have got burdens that are affecting them? There's been a lot of colic, has there been diarrhea, has there been weight loss and not doing well? And then the important part of the risk assessment, when you've established that horses are grazing paddocks, is to think about the management of that paddock throughout the year. And importantly, when you come into the spring, is think about what has been going on in that paddock in the previous year. Have there been lots of horses on it? Were they on it permanently, or were there periods of rest? Was there grazing with other species that can act as sort of biological vacuum cleaners and clean up horse worms? Another question to ask is, what's the pasture hygiene like? Is dung removed? And what's the level and frequency of removal? And where's the dung placed? And then following on from the management, we need to consider, have these horses been tested? And do their test results provide us with information about the level of burden and transmission that's likely to be there? Obviously, with more horses positive in tests, then there's a higher infection pressure and the horses are more at risk of effects of these worms. But lower test results and many horses being negative suggest that the worms burdens are more under control. And then finally, we have to consider the use of wormers. There's been a lot of use of wormers in all horses at frequent intervals. And will that switch on a little red light in terms of whether or not there might be resistance to the wormers that are there? And coming into spring, this is how you would break that down. So just as I said a minute ago, you would consider the paddock history. So we've got to think about worms not just in the horse, they're also on the paddocks. In fact, the majority of the burden in groups of horses and cattle and sheep for that matter can be out in the environment. So we've really got to think about the environment in which these horses are grazing in terms of the spring and thinking about the context of the risk factors that I mentioned a minute ago. Then we've got to think about the horse profile itself. Is that horse of an age where it may be more susceptible to worms and therefore develop larger burdens if it is grazing contaminated fields? And then we've got to dig a bit deeper into those paddock hygiene measures and those test results, and then bring all that information together to come up with a level of risk for that field and for the horses that graze on it. Now, that might sound complicated. We've developed a tool called What's Your Worm Risk, which you can access at whatsyourwormrisk.com, and it takes account of many of those risk factors when assessing the risk of an individual horse. It asks 9 simple questions, and then you get an output placing that horse at either low, moderate, high risk, and then with some sort of indicators about things you can do with that horse. So you're not on your own with risk assessment. There are tools out here. You can also look at the Cantab risk table, which I put together with Tim Mayer and Martin Nielsen, that gives more detail on assessing risk in horses, either as individuals or as groups. But these are the sort of things that might come out in your risk assessment. So if we take the 2 extremes here, if that horse hasn't grazed paddocks at all, and it's been in a box because it's been injured or because it's stabled, because it's a sport horse and it rarely goes out onto paddocks, well, its risk will be low because it's not getting transmitted with those worm stages that we know are on the paddock environment. On the flip side of that, if you have horses that have been grazing permanently on paddocks, particularly if there are many young horses present, and then you start to dig into the paddock hygiene measures and find that there's been none applied previously on the paddocks that these horses have been grazing in. And actually, when they've done some testing, they found that many of those horses have high egg counts or they've got high antibody levels if they're tested for tapeworms or small redworm, then the risk of those horses is very high. So you can start to see how you can break these things down by just asking really quite simple questions about the profile of the horses themselves, how they're grazed, how the paddocks that they graze on are managed, and any results of tests that have been applied in the sort of last 6 to 12 months. So that's a sort of paddock assessment. And then, obviously you can look at the horse itself. And again, you ask very similar questions as regards, does it graze? Does it not graze? What age is the horse? What are the paddock hygiene measures that have been applied? Have there been tests applied to this horse or the group that it's in? And what are the results like? Now, it's important that when you're looking at a horse that's within a group, that you try and find out about the results of tests of the other horses that it grazes with, because obviously all the horses on the same paddock will contaminate the environment that then is a sort of shared area. So horses are then exposed, individual horses are exposed to worms that are excreted by all the horses that it grazes with. So it's good when you're looking at a risk assessment is to consider what the test results are of not just that individual horse, but that the horses that it is actually grazing with. So we've gone through those steps, you've asked those questions, you've either done your own risk table, or you've used the Cantab risk table, or you've used What's Your Worm Risk table for individual horses, and it comes out with a readout. What does that mean in terms of how you go on to the next steps in the spring? Well, a horse that you've perhaps classified as low risk, that means you don't have to test it so frequently. That means it's got a low infection pressure, either because it doesn't graze very much, or it doesn't graze at all, or it grazes very clean paddocks. It's an adult horse, and therefore you don't have to test it so frequently because it's unlikely to be carrying a burden and either excreting eggs or producing antibodies to that burden. So what we would recommend for those horses that have a low risk, you can start fecal egg count testing in the spring to see if they're releasing strongyle eggs. And then after that, you can consider testing them every 12 or so weeks. We would recommend that those horses be tested at least once a year for tapeworm, and that can be either in the spring or in the autumn, and I'll come back to that timing in a minute. What you'd want to think about that horse going into the future as you go through spring and summer and the low risk is maintained in that horse, well, you might want to consider, has it been exposed to small red worm over the intervening period when it's at grass? And its egg counts might be relatively low, but if you're interested in looking at exposure and really wanting to confirm whether or not you need to give it a larvicidal treatment in the autumn and winter, and remember that egg counts do not detect encysted larvae, well, you can apply the small red worm blood test in the autumn and winter in that low risk horse. It's always important in low risk horses, whether they're individually kept or in a group, is continue monitoring their test results just to see if there is a change in risk level, and repeat the risk assessments just to pick up any changes in management. For example, they move into a different field, there's more closely higher stocking density, grazing rate, or there's been new horses introduced, particularly if young horses are introduced. And then and so on, if your test risk assessment comes out as a moderate risk or a higher risk, then what you need to consider are applying those tests more frequently to detect those horses that are becoming infected, particularly with egg counts, because what you want to do is to treat those horses to reduce egg shedding over the summer to reduce transmission. And in those groups, you would test in spring and autumn just to pick up on burdens that horses are developing of tapeworm. And in the winter, with a moderate to high risk horse, you would consider giving them a larvicidal treatment for small red worm. So what is the main thing that drives worm infection risk in horses in addition to an individual's own susceptibility? Well, it's that level of contamination, whether it be small red worm eggs, whether it be ascarid eggs, or whether it be infected irribated mites with tapeworms. It's that level of contamination that's on the field. And that is driven by pasture management. So the poorer the pasture management that you have, the higher the infection pressure is going to be. So when you go in and test those horses to inform your treatment applications, what you'll find that they'll require more anthelmintic treatments, and then there's a higher selection for drug resistance. On the flip side of that, if you have a very well managed field, perhaps dung's removed every day, for example, and there's a low stocking density, and it's a group of adult horses, what you'll find is the infection pressure in that group is much lower in terms of exposure to different types of worms. So when you're going to test those horses to inform your anthelmintic treatments, you'll find that a lower proportion test positive and less anthelmintic treatments will be required. And therefore, there will be a lower selection for resistance in those cases. Now, just very briefly, and actually Callum's mentioned this, what are these factors that are really helping you to drive down infection on paddocks, to drive down transmission? The most effective thing you can do is to remove dung from paddocks, because we know, as I mentioned earlier, that those stages that are excreted by horses, the eggs, do take a certain amount of time to develop through to the infective stage. The fastest development is going to be with strongyle or small red worm eggs, and what you need to do then is to pick up dung more frequently than that fastest development time, which is around 1 week in the summer. So what we would recommend is that people fully remove dung at least once a week year round, as Callum said, and ideally with increased frequency in the warmer spring, summer and early autumn months. There are obviously machines that are being developed to do this, and it's much better to find a machine that lifts the dung rather than smears it and sweeps it around, because all you're doing is spreading around those parasitic stages onto the grass. Once you've lifted your dung, remove it well away from paddocks and water courses, as Callum mentioned earlier. Again, it's not super science, but obviously the more horses you've got on a given area, the higher level of contamination will go onto that area. It's like putting 15 people in a lift or 2 people in a lift and someone's got a cold. You're much likely to spread your cold to more people in the lift when they're more concentrated. Particularly with younger horses, which will have higher burdens and they'll shed more eggs, it's important to try and keep those densities as low as possible. Now, the parasitic stages that go out into the environment don't live forever. We know that the larval stages of the strongyle parasites, such as the small red worm, they usually die out many of them by the midsummer of the next year from which they were excreted. So if you've got a contaminated paddock and you leave it free of horses between January and July, you will have a big mortality of those larval stages because they can't feed. They're encased in the cuticle of the L2 and they kind of run out of energy. However, to become completely free of parasites, we recommend to leave it at least 12 months. We don't know so much about how long ascarid eggs and tapeworm larvae survive in mites on paddocks, but what we would say is the longer you leave the paddocks free of horses to break the cycle, the safer those paddocks will become. You can use ruminants, as I mentioned, either rotationally or co-grazing with horses to act as kind of vacuum cleaners, biological vacuum cleaners, because they don't cycle the majority of horse parasites. What you've really got to be careful with is the possibility of the transmission of liver fluke, which is less host specific. And that's something that should involve a veterinary risk assessment when you're considering rotational or co-grazing with ruminants. Fecal egg counts are really important tools that everybody should now be using to inform anthelmintic treatments. I was quite disappointed to hear someone asking about vets using Pramox all the time. I didn't think anyone did that anymore, but obviously there are still people out in the wilderness giving interval treatments without really understanding the risk of the horses and the level of burden that they like to have. So every horse should be subjected to fecal egg count testing, regardless of its risk. Now, in well-managed groups, what we'll find is that most adult horses will have low burdens, and that's reflected in the sort of level of eggs that they shed. So you'll probably go in and find about 80% of the horses don't require treatment due to their low egg counts. However, it's really important to remember a couple of things. First of all, younger horses will have higher egg shedding patterns because of their burdens, because they're more susceptible to worms, and they're likely not to show that sort of 20-80 rule in terms of egg excretion. And what we also find, and I'll show you some data in a minute, is if you actually increase the transmission risk by applying poor management, such as high stocking density, no dung removal and harrowing, you find actually even adult horses become more infected and they have higher levels of egg shedding, so that more horses excrete a higher level of eggs, and a higher proportion of horses then lead to that contamination. Fecal egg count tests can be used to detect strongyle and ascarid eggs from horses from 6 months of age, and they're quite important to use in foals to distinguish ascarid eggs from strongyle eggs, because that helps inform the type of wormer that you will apply, because there's different types of resistance profile in these worms. As I mentioned before, depending on your risk, you could test every sort of 8 or 10 to 12, 14 weeks within the grazing season, and that will also depend on the anthelmintic that was last used. So if you use an anthelmintic that is likely to be more persistent, such as moxidectin, then you would probably want to increase that time between your treatment and your next test. I recommend now for horses that are outside all year, and there's many people have their horses grazing outside at least part of the day year round, is to test at the end of winter, particularly with these mild winters that we're seeing. There can be quite high levels of transmission on winter paddocks, particularly if people aren't lifting dung. It's important to remember that most eggs are small red worms, and there are some high risk situations where we might see large red worm re-emerging, and we can talk about that at the end if anyone is interested. And finally, in terms of fecal egg count tests, it's really important to use these to see if your wormers are working. And in that case, what you do is, in the horses that have been treated based on their fecal egg count, then you do another fecal egg count 14 days after treatment, and you look at the reduction in egg counts. And it should be over 95% if you've used a macrocyclic lactone in the group, a mean of over 95% egg count reduction if you've used a macrocyclic lactone, and over 90% mean reduction in egg count if you've used fenbendazole or pyrantel. This is just an example of egg shedding patterns that we see in groups of horses. These horses, particularly adult mares in this study on thoroughbred farms in the UK, had received a lot of anthelmintic treatments when we did this. Thankfully, we switched them over to doing egg-directed treatments, but at that stage, these horses were getting interval treatment applications, particularly of ivermectin. And what we found is, when we in and screened them, this is about 14 years ago now, we found that the adult horses, many of them had very, very low egg counts. There was very low proportions of horses above this is the 200 eggs per gram threshold here. and this is the frequency of detection. Whereas if you look at younger animals, whether it's 2 to 4 year old males and females and yearlings, you can see that there are many more horses have higher egg counts, with some with thousands of eggs per gram. So this is what I mean when you're looking at egg shedding. You're much likely to have lower egg shedding in adult horses and higher egg shedding in animals under 5 years old. In terms of proportions of horses that are positive in egg tests, and we're looking at the 200 eggs per gram threshold here, we find that that is related to the level of risk that we can identify at an individual premise. And this is work, in fact, we've just submitted the paper yesterday that I've been doing with Tim Mayer down at the Bell Equine Clinic in Kent. And what Tim did is he selected some yards where he thought there was different levels of risk of infection. And we talk a lot about this in Cantab, but Tim and I wanted to try and provide some evidence that linked the risk assess to the results of parasite tests, and therefore, ergo, the level of transmission. And what we did find, of course, when we categorised these into a low-risk yard where there was dung removal and no harrowing, and a mixed risk yard where there was 2 groups of horses treated differently, one where there was dung removal and no harrowing, and one where there was no harrowing and no dung removal as a mixed risk yard. And then we had 3 high risk yards where there was no dung removal and there was harrowing. What we found was that actually, as we would expect, there was a lower percentage of horses above the 200 eggs per gram threshold in the low risk yard compared to the mixed risk yard and compared to the high-risk yards. And actually, I was quite shocked at this data because I hadn't really looked at these sort of populations of horses, but there's probably quite a lot of populations of horses in the UK out there that are like this. When you actually look at the percentage of horses that are responsible for 80% of the eggs counted at a given test, and what we found in the low-risk yard is what you would expect, this negative binomial distribution where only a low proportion of horses contribute to the majority of the eggs shed. Whereas in these higher risk yards, you can see that actually quite a high proportion of horses were contributing to that 80% of eggs counted. And this means that we had a higher proportion of horses over our treatment threshold and a higher proportion needing treatment. Now, I just show this briefly because we talk about egg counts and I hope everyone's doing them and I hope they're doing them properly. But just in case there's people on tonight or watching the recording, just to get confirm how we recommend that people should collect fecal samples to get as accurate results as possible. And that includes collecting dung as fresh as possible so the eggs haven't hatched. And what we found is one of my PhD students looked at this years ago. She took different dung balls from lots of different horses and looked at the dispersion of eggs between the different dung balls. And what Hannah found is actually it's not evenly distributed. Some dung balls had lots of eggs and some had a lot less. So what we recommend is actually people collect at least 3 balls from the dung heap and give these a good mix before you put them in the label bag, squeeze out all the air to stop the eggs hatching, mix it thoroughly, transport to the lab as soon as possible, mix it thoroughly once you get to the lab, keep it cool, and then use a counting method that gives you as low a multiplication factor as possible, particularly if you're testing for efficacy because you're looking at probably lower egg counts post-treatment. It's really important to try and follow these procedures to try and get as best value out of egg counts as possible. As I mentioned earlier, you can test worm effectiveness in horses for nematode infections such as ascarids and small red worm by looking at egg counts before and after treatment at an interval of 2 weeks between the treatment and the second egg count, and look for the reduction in egg count across the group. The more horses that you include in a group, the better the statistical validity of the result that you get. So if you are applying this in practice or you're doing it on your own yard, try and incorporate as many horses as possible in your efficacy testing. Now, the sad thing about egg counts, they are really brilliant tools for looking at excretion onto paddocks, and they're really brilliant tools for looking at the effectiveness of wormers against roundworms. But what they're not so good is detecting levels of infection of tapeworm. They're actually really quite insensitive to tapeworm burdens. And this is partly because tapeworms excrete those segments I mentioned earlier intermittently. So eggs are tended to be excreted non-continuously. And quite often what we find is tapeworm burdens comprise of sterile worms that don't contain eggs, and also immature worms that don't have eggs either. So egg count methods really do have quite a poor sensitivity for detecting tapeworm. So antibody testing was developed to try and address this. And the way that antibody tests work is that worms within a horse generate an antibody response to themselves. The horse produces antibodies to those worms. They're great big antigenic organisms in there, so horses will develop a good antibody response to them. And what you find is that our particular antibodies to specific molecules that are either released or contained within the worms can be shown to correlate with the level of infection. So the amount of antibody that you measure to a specific component is actually shown to correlate with the level of burden that that individual horse might have. And what you do then is we've developed a test in the lab called an ELISA test that allows us to measure that antigen-specific antibody in the individual horse. And once you measure that level of antibody, then you get a readout that informs you of the burden that that horse is likely to have. So in terms of tapeworm antibody tests, we have tests that are available in either saliva or blood formats. And these ELISA test results are returned either as saliva scores or serum scores. And they are categorized as low, borderline, or moderate high scores. And what we recommend is that horses that have a borderline or moderate high diagnosis on both of these tests, saliva and serum, should be given an anti-tapeworm treatment, and those horses that have a low score don't require treatment. Now, it's important to understand a bit about the pathology or the pathogenesis of tapeworm, because what we know is that burdens above 20 tapeworms in the gut can cause quite a lot of damage to the intestinal wall, ulcers, and thickening. And so we want to treat those horses to reduce that pathology. So both these tests in the validation studies, it was shown that most horses with over 20 tapeworms were actually in a moderate high diagnosis category, but some were in the borderline category. So that's why we advise that all horses in borderline and moderate high categories are treated with an anti-tapeworm anthelmintic. So when to test for tapeworm? Well, particularly in moderate to high risk populations, it's important to test for tapeworm twice a year. Now, this time of year, we want to think about testing in the spring, because from work that's been done by different authors, in this case, a Spanish group, when they looked at tapeworm burdens in horses at an abattoir, they found the highest proportion of adult egg-containing tapeworms in the spring. So that meant horses with these adults containing eggs were more likely to contaminate pasture. So what you want to do is treat horses at that time of year that are positive to tapeworm to kill the worm and to stop the egg excretion. And then what they found is that over the summer months, horses do accumulate higher burdens, as you'd expect, because that's the main transmission time. And in those cases, then what you want to do is to test horses in the autumn to identify those with large burdens, which might put them at risk of colic. And work that we've done recently on the life cycle and the epidemiology of the tapeworm and its intermediate mite host has supported both autumn and spring testing. And what we found in this research study with the Royal Veterinary College is that when we went out to 3 yards in the south of England, and the research assistant at the time, she vacuumed up samples from 3 fields on each yard every month. This was a really heroic project. And she obtained the mites from these pasture samples. She counted them and she identified them to family. And what she found is that actually the number of mites that you can vacuum up from these paddocks super increased in the spring. And as you'd expect, this is when the mites become more active, they come out the soil and they start doing their mite thing. And what we then did as part of the project, we designed a PCR to look at the DNA of these mite samples and see if we could find tapeworm DNA in the mites. And what we found is the tapeworm DNA in the mites showed this similar seasonal pattern, with tapeworm detected in many, many mite samples recovered across the season, particularly in the spring and summer, when over 70% of samples were positive for tapeworm. I mean, even here, you can see in April in the second year from all the samples recovered that 90% of them contained tapeworm DNA. So you can see this real transmission cycle. These were quite highly prevalent yards where there was infections going on and cycling. You can see how difficult it is to control once these mites become infected with tapeworm. EquiSal itself, so that was a situation there in a high prevalence situation. If you look at the entire data set of EquiSal, which is now over, well, it's now over 300,000, but when we looked at this data set, it was over something like 250,000, I think. And when we looked at the number of horses that tested positive or negative, i.e. low versus borderline, moderate, high, we actually found that over 65% of the horses were low and negative and were not then required to be treated for tapeworms, whereas only a third were. And that's a significant reduction in anthelmintic use by using these tests. And this is typical as well of what you'll see. These are just some exemplar yards from our data set. And actually, fear not, if you've got good management and an adult horse population, you're likely to have low levels of tapeworm with a low prevalence on most yards. What we find is the occasional problem yard where there's a high prevalence infection, and usually when we go in and talk to people at those yards about what they're doing, we find that there's no dung removal, we find there's probably harrowing, and there's a high stocking density. On some occasions, we are concerned that we might actually be starting to see tapeworm resistance on some of these premises, particularly if they've started to implement better management alongside dense-directed treatments, but the levels of antibody don't go down, and we're continuing to research that. So I'd just like to finish up after that very fast canter through spring worm control in horses about where your spring actions would fit into a calendar-based control programme. So here we are in the spring. So what we probably want to do at this time of year is to do a risk assessment and categorise those horses as high, low or moderate risk. If we identify, particularly in high risk and moderate situations, where can there be improvements in management? So we need to think about how we can drive better management across the year and take a pragmatic approach. What we find in high risk situations is sometimes best just to prioritise the simple things first so that people can start to get like a chip into their parasite control rather than overwhelming them with lots of management changes. So it's important to prioritise the achievable things in a high-risk situation. And then, of course, we would apply our testing after a risk assessment to identify which horses are positive for tapeworm, which horses are positive for strongyl eggs, and then we would treat accordingly. And then going into the summer, then we would go on with our continued egg count testing to test horses that weren't treated at this time of year, but also to test those horses that were treated. And this is a good time to consider testing the effectiveness of wormers because it's more likely that we'll have higher egg counts, strongyl egg counts in the summer, and therefore you'll have more horses to incorporate into your test. And then depending on the wormer that you use, then you would do a later summer fecal egg count just to pick up any horses that have either gone positive again or have come positive that haven't been treated due to testing earlier in the season, and you can pick them up. And then as we go into autumn and winter, then we consider another tapeworm test to identify those horses that have picked up tapeworms infections across the spring-summer season and in low-risk groups. If we want to try and reduce the amount of larvicidal treatments, then we would go in and use a small red worm blood test that will tell us that which horses have got low burdens that don't require treatment. And that's me. Thank you for listening.
Brilliant, thank you, Jacqui. That was fantastic as always. So we have had a few questions come through. I'm just going to start off by saying I think it was great to have the explanation of how to do the fecal egg counts because I think sometimes people are a bit unsure about sort of doing that correctly. Would you be able to talk us through anything that people have to bear in mind when they're doing the EquiSal test as well, please, for those who've maybe not done that one before?
Yeah, thanks, Katie. That's a good question. I really had half an hour tonight. So
sorry, I was limiting you on time tonight.
Yeah, so the EquiSal test, it's really one of the main things to do is to make sure that horses haven't exercised, fed, or had something to drink in 30 minutes before you do the test. And that's because the antibodies are secreted into saliva at a constant rate. But if horses increase their saliva production, particularly if they've eaten or drank anything, that would have the effect that it dilutes the antibodies in the sample. And when you put that into the EquiSal swab and you collect it, that means you have a sample that's got diluted antibody. And as part of the test, as part of the controls of the test, we measure the total antibody that's in that sample, and that allows us to assess the level of parasite-specific antibody. And if the total antibody fails the QC test because the saliva is so dilute, then we'll let you know, and we'll probably give you another shot to retry it again free of charge. But that's really important. I think people are getting better. We don't see as many failing that QC test as previously. There are some horses that are naturally slobbery, and we suggest all these things, and we eventually have to say, well, we suggest that you use a blood test instead, because your horse has just always got too dilute antibody in its saliva.
Yeah, absolutely, too not working. So we had another question from somebody asking about a saliva test for small red worm, if that's something that's in the works.
So I'm the person to ask. So we are looking at that. We are doing research on it, but I don't think it'll be something that's coming imminently. There's a lot of work to be done on it. We're very careful about the tests we develop when we validate them properly. We wouldn't like them to be misused or misinterpreted. The negative sequelae would be they would miss too many horses that were positive, or more likely would pick up too many horses, and then that would lead to perhaps more treatments that might be necessary. So we're right in the middle of looking at antibody levels in saliva to small red worm and considering, well, this might be some sort of test option for the future, whether it would help people assess risk, for example, by looking at screening for exposure. So watch this space.
Watch this space. We're not quite there yet, but
no,
hopefully one day. Brilliant. And then just one last question for now, and then I might leave you to have a go behind the scenes, Jacqui. But we've had somebody ask, if you're using postal fecal egg count services, how does the fact that the sample isn't kept below 6 degrees affect the results?
Well, I think the thing is to get it there as quickly as possible and as cool as possible. That's probably the best thing. I think if you get it there within 5 days and it's not like super warm, you're probably okay. But if it's like the middle of summer, for example, and we're hitting 20 degrees and the sample's sitting about in the post for 4 or 5 days, those eggs can hatch and they won't be detected in a fecal egg count method because of the types of solutions that are used. So I think these are things probably, if people are using particular services, is to reach out to their service provider and ask them how they reduce that impact of that happening, particularly as we go into the warmer months.
Oh, brilliant. Thank you very much. So there have been a few more questions. I know Callum's been very busy behind the scenes answering some, but I think there's a few questions left and there's a couple in the chat box as well. So if I can possibly leave you to both have a little look at those, that would be great. And I'm going to now share my screen and move on to my part. So hopefully that should now be there for everybody. So for my part of the presentation this evening, I'm just going to expand a bit more on the horse's digestive health kind of as a whole, and some of the key things that we can be doing to support gut health alongside our sustainable worming programs. My computer's a little bit on slow. There we go. So you've probably all heard the phrase no foot, no horse, but I quite like the saying no gut, no horse. I've listed just on the slide there some of the reasons why gut health is so important, kind of overall health and well-being. And to be honest with you, I feel like I could probably do a whole talk on each of these alone, but sadly we don't quite have enough time today, but I will be touching on some of these as we go through tonight's presentation. So again, we haven't quite got time this evening to go into a sort of full in-depth of the horse's digestive system from start to finish, but I just wanted to include a bit of an overview and really help set the scene for those of you who perhaps not covered much on the equine digestive system before. So one of the most important things that we need to remember is that horses have evolved to eat fibre or forage, and so their digestive systems are very much set up for this purpose. That's all the way through from the mouth, which is the start of the whole process, through to what comes out the other end. Now, fibrous feeds, so forages and things like that, will require much more chewing than cereals or concentrate feeds like pellets and mixes and things. And because the horse only produces saliva when they're physically chewing, if we've got kind of more time spent chewing and more forceful chews when that fibre is being consumed and broken down, we're also going to then have more saliva that's being produced. Now, saliva helps to lubricate the feed and keep everything moving nicely, but it also contains bicarbonates, and this is important to help buffer acidity in the digestive tract, and this can reduce the risk of problems like gastric ulcers, for example. So from the mouth, we pass down the esophagus into the stomach. Hopefully you can see my mouse there on the screen. And this has got quite a fairly rigid structure, so it can't stretch to accommodate sort of large concentrate meals. It also produces acid almost continuously, regardless of whether the horse has actually eaten anything. So this is one of the reasons we're trying to aim for trickle feeding or feeding often in our horses' diets. We also then have the small intestine, which is that long sort of wiggly narrow tube in the diagram. And this is where the absorption of many nutrients takes place. So things like our protein, fats, sugar, starches, vitamins and minerals. And then after the small intestine, we move on to the hindgut, which is that big sort of darker brown bit in the diagram. And this includes a few different sections, including the cecum, the large colon and small colon. And as you can see, this part of the gut is proportionally really the largest part of the digestive system. And the reason for this is that it's the site of fibre fermentation. We know that fibre should represent the largest proportion of the horse's diet, so it needs lots of space to break it down and ferment it. And this is where we're going to focus a little bit more on today. So as you saw from the diagram on the previous slide, the hindgut makes up a pretty large proportion of the horse's digestive tract, around 60% of the whole volume. Now, since the horse doesn't have specific enzymes that they need to break down fibre, instead they rely on a population of bugs or microbes in the hindgut, and it's these that break down fibre through a process called fermentation. And with this process, these bugs essentially transform the fibre into what that bugs can then utilise. So this comes with the production of short-chain fatty acids, or SCFAs. You might sometimes see these written down as VFAs or volatile fatty acids, but essentially they're the same sort of thing, really. So these short-chain fatty acids very much allow us to obtain quite a substantial amount of its energy requirements from fibre diet. And interestingly, there's been some recent research in the last couple of years showing that horses in even very high levels of work, such as those in race training, can obtain really sufficient energy intake from a high proportion of fibre in the diet for their level of exercise. So the three main types of short-chain fatty acids that are being produced are acetate, and this is one of the sort of main energy sources for the horse. We also have propionate, which is converted to glucose for energy use or storage. And finally, we've got butyrate, which is really important for maintaining gut health, and as it provides an energy source which help to keep the cells that line the gut really nice and healthy and keep them functioning and working as they should. And we'll come on to that in a little bit more detail a little bit later. And there has been some research showing that the type of diet that your horse is consuming can affect which fatty acids are produced in the hindgut. So, for example, if we've got high fibre diets, these can increase butyrate and acetate production compared to a high starch diet, which will produce higher levels of propionate. And since butyrate production is really beneficial for the cells that line the gut wall and keeps them healthy, it's really another reason why we want to be feeding a high fibre diet as much as we possibly can. So before we kind of move on, I just wanted to touch on the term microbiome, as it's one that you've probably heard a little bit about recently, both in equine nutrition, but also in the context of human nutrition as well. And there are a couple of key terms which often get used interchangeably, but do actually have quite a distinct difference. So firstly, the microbiota is the population of microorganisms or bugs in a particular location. So for example, in the hindgut, in this case. And this includes things like bacteria, fungi, protozoa, and other bits and pieces like that. Bacteria are very much kind of the most prolific of all of these microbes. So this is, to be honest, where most of the research has focused so far. And then we've got the microbiome, which refers to not only the microbiota, so the sort of genetic material from that, but also everything else in the environment. So things like metabolites, viruses, bits of DNA from dead cells that might be kind of floating about, proteins and environmental conditions as well. And an analogy that I quite like is that the microbiota are kind of like the people and the pets and the bugs that live in a house. And then microbiome would refer to the house itself, and all of the furniture and decor and temperature and everything else in the house, as well as the people and pets and things like that. So the microbiota is just the bugs themselves, and the microbiome is bugs plus everything else. Now, obviously, today we are talking about the horse's hindgut microbiome and microbiota, but there are lots of other microbiomes in your horse's body, and indeed in our own bodies. And these other locations, such as in the mouth, the respiratory system, and on the skin as well. So you might hear about those in different contexts, potentially. So as well as fibre fermentation, the hindgut does have some other really important roles. So as part of the process, the bugs in the gut also produce B vitamins and vitamin K, and these have important roles in the body. B vitamins include things like biotin, which is something that many of you will perhaps be familiar with as a hoof supplement. But I think perhaps not as many people realise that the horse actually makes its own biotin in the hindgut as a natural part of this process. So for this reason, if we've got a horse with poor feet, it can sometimes be an indication that the gut perhaps isn't as healthy as it maybe could be. So rather than just adding a biotin supplement, we can also look at what else is going on, whether there's anything else we can do to make the gut healthier, whether that's by feeding a bit more fibre or some other things which I'll come on to shortly. Generally, if we've got healthy on the inside, it can lead to healthy on the outside. So it's definitely something else to bear in mind. And the next thing is heat production. So the population of bugs do produce heat as well while they're working hard for fermenting the fibre. And this is one of the adaptations that the horse has to help them keep warm and maintain their body temperature when it gets colder. So it's basically like their own central heating system and kind of keeps them warm from the inside. Now, of course, there's lots of other factors that can influence how well a horse maintains their temperature, but ensuring that your horse has plenty of forage and is eating plenty of fibre is definitely a really good place to start in supporting the horse over the colder months. And then finally, the bugs in the hindgut also play a vital role in immune function, sort of overall health as well. So the immune system in the mucosa, the gastrointestinal tract, represents the largest component of the immune system in the horse's whole body. It contains around 75% of all the lymphocytes and white blood cells in the body, so it's definitely important there. And if we can maintain a healthy balance of good bugs in the gut, in preference for harmful species, this can help to prevent the harmful species from sort of becoming established and potentially leading to disease. So with a healthy gut, we have a really nice, strong and healthy, intact intestinal barrier. So protecting what's inside the gut from what's outside the gut from what's inside the gut. And this intestinal barrier is lined with mucus, which helps to protect the cells lining the gut. And this mucus is continuously being replenished. It's being utilised by the bacteria in the gut as an energy source as well. And we think back to our previous slides that butyrate, one of the short chain fatty acids, that also provides an energy source for cells in the gut wall, keeps them healthy. Now, just like us, horses will inevitably consume some harmful bugs and pathogens and things on their travels, but in normal circumstances, these would stay in the gut and just simply pass through without causing any problems. But if we have a situation where the horse is on a lower fibre diet, the mucus layer can start to become eroded. And this mucus layer is very much the first line of defence that the gut has against pathogens. So we definitely don't want it to start to break down. And again, if we've got lower fibre diets, it can also compromise the health of the cells in the sort of tissue itself, in the epithelial layer. And if these are compromised, then we might start to get kind of gaps that are occurring in sort of between those cells, and these can get bigger, and the gut can start to become more permeable or leaky. And then what happens here is then substances which shouldn't be escaping from the gut, so all those sort of nasty pathogens, do start to cross that intestinal barrier and can enter into the bloodstream and into the horse's body. And this then can potentially trigger an inflammatory response and lead to poor health and disease. So ultimately, the reason it's going wrong here to start with, if we think back on that process, is that there's too little fibre. So this is something which I would tend to suggest is particularly relevant for performance horses or race horses. It can happen to any horse, but those horses in particular, because these individuals will typically be exposed to more pathogens. They're travelling, competing in lots of different locations, maybe going out to train as well. And yet traditionally these types of horses would always be fed quite as much forage in the way that they've traditionally been managed. So I think it's definitely something to consider here when managing these types of horses, just to help optimise their health as well as their performance, and just really make sure that we are feeding enough fibre. So what does a healthy microbiota look like? Well, in recent years, there's been more and more research into the equine gut microbiota. And I think one thing that has come from it is actually there's a huge amount of individual variation and so many different factors that can influence the microbiota. As well as differences between individuals, there's also differences between different populations, which could be influenced by things like breed, environmental conditions, as well as the sort of food and forage that they're consuming. And as well as this, even within individuals, their microbial population may be different in the spring compared to in the autumn and winter. So this means it's really, really difficult to quantify what a healthy microbiota looks like and sort of what types of species and things are being found there. But the research is progressing, so hopefully in the coming years we will sort of start to learn about it. But at present, it is thought that kind of generally speaking, if you've got a lower richness and diversity of species in the gut, this is potentially detrimental to health. So if we've got greater richness and more diverse microbiota, so lots of variety of lots of different species present in roughly equal numbers without one type dominating too much, this type of gut will generally be resilient and potentially better at returning to baseline levels after a change or external stress or problem or some sort of issue. And if we have a forage-based diet, this is going to help promote microbial diversity and help that horse's gut to sort of adapt to change a little bit better. And you might have also heard the word dysbiosis. I think Callum mentioned it in his presentation as well. And just to sort of repeat that, this refers to basically as imbalance of microorganisms, usually associated with disease, and can sometimes lead to clinical signs like colic, diarrhea, laminitis, just to name a few. So I think, as I said, there's still much more to learn about this area, but something which has been coming out recently is that this dysbiosis in the gut could also play a role in other inflammatory related issues. So even things like asthma, which you just wouldn't necessarily immediately think that was linked to the gut, but there could be a link there. So it's, I think, something that we'll definitely have more coming out about this in the next few years as an industry. The other thing to note is that diseases themselves can also cause dysbiosis. So sometimes it's a bit difficult to know which came first, whether it was the disease or dysbiosis. So yes, definitely lots more to learn on that. So watch this space. So what should we actually be doing in the context of the diet and nutrition to help support a healthy gut? Well, as I mentioned, I think we firstly want to make sure we're providing a diet which is sympathetic to the horse's digestive tract and how it has evolved. So we spoke at the beginning how horses' digestive systems have evolved to consume really nice high fibre diets. This is when it's going to function best. So this should definitely be the priority when it comes to supporting gut health. We know that saliva has benefits to buffer acidity within the gut. If we've got a high fibre diet with lots of chew time, this can increase saliva production. And our high fibre diets also help to keep that microbial population or the good bugs in the gut really nice and healthy. So definitely it's a case of fibre first and making sure that's sufficient with the diet. So how much fibre does the horse need? Well, to be honest with you, we don't really know as an industry how much fibre a horse needs. So fibre is the nutrient, but we do know how much forage. So forage is kind of physical feed stuff like hay or haylage, for example. With recent research, there has been a bit of debate over the years, but recent research and kind of currently the recommendation is 1.5% of the horse's body weight on a dry matter basis. And something that's really important to point out here is this is based on the horse's current body weight. So if you've got a horse who is a bit overweight, you still work to their current body weight and not their target body weight. And we also talk about the dry matter content and feeding on a dry matter basis. And the reason this is important is because all forages will naturally contain some level of water, which will dilute the fibre and nutrients that it contains. So, for example, even hay is around 15% water and only 85% dry matter on average. If we don't account for this level of water, then we could end up significantly underfeeding, especially if we're using a haylage, which has probably got a much higher moisture content and a much lower dry matter content than hay. So this is really why we need to make sure we're feeding more haylage than hay, because of that higher water content, which is diluting fibre and nutrients that it contains. So if we do the maths on this, if we've got a 500 kilo horse, looking at 1.5% of their body weight, this would equate to 7.5 kilograms on a dry matter basis daily. If we are then using a hay that's got a dry matter level of around 85% or 15% water, this would equate to 8.8 kilograms per day as fed if we factor that water level in. Or if we're using a haylage that's got a higher water content and maybe a dry matter content at 60%, this would equate to 12.5 kilograms as fed. If you do need any help with the maths, I know maths is not everybody's strong point, so if anybody would like any help working out forage quantities, you can contact our feed line and we're very happy to help with that, and I'll put the details on the slide at the end. And so even for overweight horses, we still want to make sure that they are consuming enough forage so that we can support their gut health. So for these individuals, it's generally preferable to try and reduce the calorie level of the forage they're having rather than the amount that you're feeding. So we still want to make sure we're meeting that 1.5% body weight. And so to do this could include things like using a later cut forage, soaking your hay, or incorporating some straw into the ration. We've got lots of information on our website and YouTube channel on forage for the good doer, so you can have a look at those if you're interested to learn more. And so it's very much about getting the right forage for the right horse. And to do this, we need to look at the digestibility of different fibre sources, because this is what's going to influence how much digestible energy or calories that they are providing to the horse. So fibre can be provided from different places. There's lots of different ingredients that will contain high levels of fibre. For good doers, we can look at using forages which are less easily digested by the horse, that provide few calories, whereas for poor doers, we want something which is more digestible, easier for the horse to break down. And fibre sources like straw or a later cut hay will typically be less easily digested by the horse because they're harvested later in the season. So the plants are more mature, the plants are taller, so they need structure to hold themselves up. And make sure that they stand up straight and aren't flopping all over the place. And it's this structural fibre which is in the plant cell walls, which is less easy for the horse to break down. So that's why we describe these as being less easily digestible for the horse. And this means the horse can't extract as many calories from it. And in contrast, when we're looking at the other end of the scale, our high fibre ingredients like alfalfa and sugar beet pulp provide a much greater contribution of digestible energy. We at Dengie, we cut our alfalfa earlier in the season when the plant is younger, so it's not as mature, it doesn't have as much structural fibre, and then we precision dry it at really high temperatures so that we can lock in all the natural nutrients that it contains. Sugar beet pulp grows underground, so it doesn't really need as much structural fibre to hold it up. So as a result, it's much easier for the horse to break down and digest. Sometimes people are worried about the name with it being sugar beet pulp, but actually the sugar is extracted and goes into the human food industry, and it's this really lovely, easily digestible, fibrous beet pulp that we have left over, which goes into the animal feed industry and is a really great ingredient in feed. So it's all about getting the right fibre source or the right forage to suit your horse, and then making sure we're feeding enough or suitable levels to support their digestive health. So making sure we're feeding enough forage is the first step in supporting gut health, but what else should we be looking at? Well, firstly, we want to avoid making any sudden changes, including any changes to the forage, and ideally making dietary changes really slowly over a good couple of weeks. Abrupt dietary changes can affect the stability of the bugs in the gut. They typically become adapted to the type of feeds or type of forage that's being consumed. And so if we introduce something a bit too quickly, it can cause problems and potentially dysbiosis can occur. And the other points I will cover in a bit more detail in the following slides, so things like reducing starch intake, minimising stress, and some digestive aids in the ration as well. The other point, which I haven't mentioned here, I'm of course not a vet, but Callum did mention it earlier, and that's the sort of impact that medications like wormers will have on the gut as well. And these can, as he mentioned, can lead to things like dysbiosis. So making sure you're using strategic use of your medication and wormers, and ensuring you're consulting with the vet on that, and avoiding our blanket worming is definitely also really important when it comes to supporting our digestive health. So just going on to the impact of starch and why we want to really be keeping that as low as we can in the ration. Something that's really important to be aware of is that the horse has quite a limited capacity to digest starch with enzymes in their small intestine. And if there's too much starch, sort of all in one go, it can't be digested in the foregut. When this happens, we can end up with overspill into the hindgut, where it may undergo fermentation. And that's not what's supposed to happen. The starch is meant to stay in the foregut, and we're meant to have our fibre being fermented in the hindgut. So if we've got too much starch being fermented in the hindgut, this can result in increased lactate production, making the gut more acidic, killing off all the beneficial bacteria that are there, and potentially causing harmful bacteria to proliferate. In contrast, our fibre-based diets just can help to maintain much more stable bacterial communities. And if we think back to previously in the digestive system, those of you who've kind of looked at anything at all about gastric ulcers before will be aware that high levels of starch in the diet can increase the risk of gastric ulcers, particularly squamous gastric disease. So if we can reduce the level of starch in a horse's feed, even for those who with no digestive health problems, it is only going to be a benefit for their gut health. I think a common misconception is that horses do need a lot of starch in their diet to be able to perform. But as I mentioned earlier, there is research now to show that even top-level performance horses in training can be sustained on high fibre diets without as many cereals. But the key thing is, as long as that quality of that fibre is good enough to provide the energy, the digestible energy that they need. So this comes back to using our easily digestible fibres, things like alfalfa, that the horse can easily break down and utilise. And this is, I think, without question, so much better for their digestive health compared to a high starch diet. And as I said, it's been shown to have no detrimental impact on performance, which is a really positive finding and certainly very promising for the future in terms of how we are feeding and managing these horses in high levels of exercise. So next up, we've got the use of digestive aids or biotics. There's been quite a lot of research in recent years on the use of pre, pro and postbiotics in horses, as well as in humans and other animals as well. And these ingredients can potentially help to improve nutrient digestibility, reduce stress-related behaviours, and also support immune function. Probiotics is possibly one of the most well-known, or the more well-known terms here. This would refer to things like Yakult in human food. Bacterial probiotics are live good bacteria that put in to help increase the numbers in the gut. However, something that's really, really important to be aware of is that there are no live bacterial probiotics are licensed in the UK. There's none that have been demonstrated to be safe and effective for use in horses. So these aren't legal to use under kind of UK and EU feed legislation. So if you do see a product that says it contains probiotics, it probably is referring to live yeast So yeast is a fungi which helps with fiber digestion by breaking down the structure of the fiber ready for the bacteria to ferment it. So it's a bit like a grown-up cutting up a child's food with a knife and fork before they eat it. So it's getting it ready for the next stage. And yeast has also been found to help create diversity and stability in the microbiota. So certainly a really useful ingredient. Next, we've got prebiotics. So these act on bacteria in a couple of different ways. So there are a few different types. One of the most common would be FRSE prebiotics, which is our fructooligosaccharides. And these act as a food source for the good bacteria that are already in the gut and can help the gut to be a bit more resilient to change. So it's potentially quite a useful option for horses that have maybe just moved yards or who are frequently travelling or competing, and sort of there are some changes that are going on for them. And then finally, postbiotics, which is a relatively new term. And postbiotics are inanimate or dead microorganisms, all their components that are beneficial for supporting gut health. So if our inanimate or our dead bacteria still kind of retain their basic structure, they can still be sensed by other microorganisms or other bugs in the gut who will react to them, and they can still have a positive effect, even though they're not alive as such. And it's really important to note these ingredients are not a treatment or preventative for any digestive health issues. No feed or supplement should be referred to as a treatment or preventative, but they can be useful to support fiber digestion and the health of the gut. There's a few different ways of including these ingredients in your horse's diet. So you can either utilise a supplement, which may contain one or more of the biotics, or otherwise feeds may have them included as part of the formulation. I've just included the Dengie Healthy Tummy and Ulcer Light on the screen there. We've recently updated our formulations for these two feeds, and they now contain prebiotics, probiotics, live yeast, and postbiotics as well. So they do offer a good package for digestive support. The Healthy Tummy is alfalfa based. It's got a high level of oil, so it's a great option for poor doers, whereas the Ulcer Light's aimed at good doers who don't need as many calories. If you do have any further questions on these, if you'd like information, then do just let us know. And the final point I wanted to speak about today when it comes to gut health can sometimes be much harder to achieve, and that is to minimise the impact of stress. Now, we all like to do different activities and things with our horses, and so ultimately these will cause them stress to some degree, but it's really about how we manage that stress, minimise it for them, that we can potentially do something about. So it's really looking at what's going to work best for each individual. There have been some studies in other animals as well as horses to show that stress has been linked to an increased permeability or leakiness of the intestines, meaning that there's an increased risk of that intestinal barrier starting to break down in some way, and then pathogens escaping from the gut into the body where they can cause disease. So things like transport and exercise have been sort of suggested to be a factor here. The study that I've referenced on the screen there is published in 2022. This looked at horses who were transported for 1 hour, followed by 30 minutes of moderate exercise, and they compared them to horses who were stabled, and it was a crossover design. Now the transport followed by the exercise setup, that was designed to mimic a kind of normal routine of a competition horse, so hour of transport and then 30 minutes of exercise. Now both groups of horses were fed or a sort of a nasogastric tube, given a marker, which was then assessed for sort of a test for in a blood test at various time points during and after the exercise and stabling procedures, to see if and when that marker became detectable in the blood. So really to see if the gut had become permeable, causing the marker to leak out of the gut and enter into the bloodstream. And they found that the marker increased to a greater level in horses who were transported and exercised, suggesting that the gut had become a little bit leaky, and there was also some level of inflammation present as well. Now, it wasn't a perfect study design, but I think there's definitely more work to be done, as with all of these things. But I think it does just highlight how perhaps these competition horses who are regularly travelling and exercising in healthier environments may be at a greater risk of digestive issues, whether that's linked to stress or other factors in management. And just really does reiterate how we need to take sort of all the precautions we can to keep their guts healthy, of lots of fibre and so on. There was a paper that was published just last year that found kind of relatively short term, so around 10 hours of social isolation in a new environment, increased stress, which was shown through increased cortisol levels. And again, intestinal permeability also was increased here. So I think stress does definitely play a role, but we just need to do a bit more work to find out exactly what sort of that role is and what the other factors are. And then finally, I keep going back to gastric ulcers, but there has been some research suggesting that stress is linked to glandular gastric disease in the stomach. So if it has a role up there, there's a likelihood that there could be some influence of stress further down in the tract as well. So when it comes to managing stress, it's important to look at the possible causes. These can include things I've just listed on the screen there, so things like pain, illness, fear, social isolation. It could also occur if the horses are perhaps unable to have a good look at or respond to any potential threats. So, for example, if they're in a stable or they're not able to investigate or escape from loud noises or other things that may be causing them some worry. There's other things like different handlers who might have different boundaries when they're handling the horses. Even that can potentially increase stress, and that is something which has been identified as a risk factor for glandular gastric disease as well. So stress in horses can be very variable. Ultimately, you know your horse the best, and it's just important to be as objective as you can be in looking at whether anything might be worrying them. So questions you could maybe ask would be, is there stable in a busy or is it in a quiet area? Is there a public footpath nearby or anywhere where they might have interactions with members of the public or loose dogs or anything like that could be causing them worry? Building works or loud things going on near the yard, and also as simple as whether they get on with their companions or their field mates as well. So there's lots of different things to consider, and it just might take a bit of trial and error to see where your horse appears to be most comfortable, and this could potentially help in managing any digestive issues that may be going on. So to round up, our top tips to take away from tonight's session to really just support your horse's digestive health. Firstly, as a real minimum, we want to be making sure our horses are eating no less than 1.5% of their body weight in forage on a dry matter basis every day. I would encourage everybody, if you don't do this already, to get yourself a spring scale and weigh out how much forage you're feeding and then weigh what's left. Not only can this help you to make sure they're eating enough, but it can also help you to monitor their appetite, to spot any problems or changes sooner, as well as also helping you to plan for your hay supply and hopefully help reduce waste, which I think is something that all of us are needing to be far more aware of this year with climate change, and many of us when forage is in much shorter supply. And we also want to keep our starch intakes to a minimum, avoiding cereals wherever we can. We need to be honest with ourselves and consider if there is anything in our horse's environment or management that may be causing them some stress, and if there's any way we can manage that. And utilising feeds or supplements containing digestive aids can be beneficial, particularly for horses who are regularly travelling or competing or moving yards, as well as older horses or any that may be prone to digestive upset. And finally, remember to make any dietary changes, including changes to the forage, as slowly as you can over a couple of weeks. So that brings me to a close nearly for my section of the webinar this evening. For those of you who are keen to learn more, we've a number of past webinar recordings on our YouTube channel, lots of articles on a whole range of topics on our website, and you can also contact our nutrition team for free feed advice and support. I've just popped the information on there.